Moving to the next question, the 212 configuration type of canal, it is seen in which Vatusi classification? The answer is type 6. So the 212 type configuration, it is seen in type 6 Vatusi classification. Let us discuss the Vatusi classification. Type 1 configuration, it has a single straight canal from crown to the tip of root. So the type 2 configuration, the two canals they split as one in the apex. Type 3 is one canal exit the apex. The one canal, it divides into two and has a single exit. Type 4 is 2-2, that means two separate canals exit two separate canals. Type 5 is a single canal that divides into two. Type 6 is two canals that forms a one canal and then exit as two. So type 7 is one canal that divides into two joints and exit as 2. 1, 2, 1, 2. And type 3 is three different canals. So 212 configuration, it is seen in type 6. Moving to the next question, the steel plier, it is seen in. So steel plier, they are specific type of dental instrument that are used to grasp and hold the silver points during endo procedure. So silver points were previously used as root canal filling materials. So answer is B. They are not used to contour metric bands, as metric bands are used in restorative dentistry to create proper tooth shape while placing the dental filling. Used to remove roots during hemisection. Hemisection, it is a dental procedure that involves the removal of one of the root. So they are not used for this procedure. Used to place rubber dam clamp on tooth. Rubber dams, they are placed on tooth. The rubber dam clamps, they are placed on tooth to isolate it during the dental procedure. So they are not, so these pliers, they are not used to place rubber dam clamps on the tooth. So answer is B. So it has, these pliers, it has two ends. One is the straight end and other is the curved end. So that is used to hold the silver points during the procedure. So during a root canal procedure, when a dentist need to place and compact silver points into the prepared root canal, these pliers are used to grasp position and manipulate with these. Moving to the next question. The first step in removal of rubber dam is, the first step in the removal of rubber dam is cutting the interdental septa. So the removal process begins by using scissors or punch to cut the interdental rubber connecting between the dam. So that these steps would create separation between teeth allowing for the easy removal of the rubber dam components. After cutting the interdental rubber septum, uh, the next step is to remove any clamp. So suppose this clamp is placed, you have to remove this clamp or retainer that were used to secure the rubber dam in place. And afterwards the rubber dam sheet it is removed. So the first step is cutting the interdental rubber. That is the first step. Moving to the next question, the solvent used along with H files to remove the gatta pacha is chloroform. Well, chloroform it is a solvent that is used to remove the gatta pacha from the root canals. It is a gatta pacha solvent. Gatta pacha, we know it is a material that is used for filling and sealing the root canals during endodontic procedure. So the chloroform it is applied to gatta pacha within the root canals and it will soften the GP. It will soften GP plus dissolve it, and that makes it easier to remove. So remember that this chloroform it is effective in softening and dissolving the gatta pacha. Moving to the next question, the technique of choice for removing poorly condensed gatta pacha is we use hand instrumentation. So gatta pacha it is commonly used for filling and sealing root canals during endo procedure. When the GP it is poorly condensed or compacted within the canal, it may be removed for the retreatment. So hand instruments involves the use of manual endodontic instruments like the H files, reamers that are used to remove the gatta pacha. So when the gatta pacha it is poorly condensed, hand instrument is the preferred technique for its removal. So the flexibility and tactile control that is offered by the hand files that allow for the removal of the inadequate compacted gatta pacha. Moving to the next question, the first generation apex locator work on the principle of, well, the first generation apex locator it works on the principle of resistance. So it is also known as resistance apex locator. So this apex locator it measures the resistance to the flow of direct current within the root canal. So it assumes that the resistance is relative constant. So that allow to assist in locating the root apex during the endo procedure. So when a small amount of current that is applied to the tooth, it will encounter a resistance. To the flow of the direct current within the root canal. So it will encounter resistance as it travels through the tissues and fluid within the canal. So this apex locator it is based on the fact that resistance that is offered by periodontal ligament and the mucous membrane it is constant. It is consistent around 6.5 kilo ohms. So this consistency is key factor in determining the position of root apex. So this resistance value is a key factor in determining the position of the root apex. So as the device measures the resistance, it can detect the changes in the resistance when it reaches the apex of tooth. So this change in resistance will indicate that the device it has reached the apex. That will allow the dentist to stop instrumentation at the correct depth during the root canal procedure. So first generation apex locator work on the principle of resistance. Moving to next question, the AH sealer. Well, the AH sealer, it is resin based. So the resin based sealer, they are so these it is resin based upon the epoxy resin based sealer. So AH is epoxy based sealer. The methacrylate resin based sealers, they are hydrone, epiphany, fiberfill, and the polyvinyl resin based sealer, they are diakit. So root canal sealers can be divided into zinc oxide based sealer that contains eugenol or non-eugenol. So you can get a question in exam. The Grossman sealer, it is a eugenol sealer. The Rickett formula, it is a eugenol sealer. Tubely seal, Fast seal, all these are eugenol based sealers. And the non-eugenol sealers, remember them. Apart from that, there are iodoform based sealers, polyacrylic based sealers, calcium hydroxide based sealers. The example is Seal Apex, White Apex. So these are the calcium hydroxide based sealers. There can be silicone based sealers or bioceramic sealers. So remember, the Rocco seal, it is example of silicone based sealer. Moving to the next question, for aesthetic restoration after intracoronal bleaching, the teeth should immediately be treated with. It would be treated with. You would rinse the tooth with catalase for 3 minutes. So why? So catalase, we know it is an enzyme that helps to neutralize any residual hydrogen peroxide that is commonly used in intracoronal bleaching. So rinsing with the catalase helps to ensure that this bleaching agent it is fully deactivated before proceeding with the aesthetic restoration. So the intracoronal bleaching, as we know, it is also known as walking bleach. So this technique, it is typically performed on teeth that have undergone root canal treatment and have become discolored as a result of internal factors like pulp necrosis, pulp hemorrhage, or use of certain dental materials. So answer here is A. Moving to the next question, the electric pulp testing should not be done on. The answer is C. The electric pulp testing, as we know, it is a diagnostic tool that is used to assess the vitality of the tooth pulp. So that works by applying an electric current to the tooth. There are situations where that electric pulp testing should not be used, like in case with full coverage restorations, like a placement of crown over the tooth. So these restorations generally are made up of porcelain or metal. So we know these are poor conductor of electricity. So when you apply electric current during the electron pulp testing, the current would not penetrate the restoration, and that would make it difficult to assess the pulp vitality. So that is why answer is C. So because the electric current, it may not reach the pulp through the restoration, it may produce a false negative test. Moving to the next question, the hollow-like appearance of bone it is seen in. Well, it is seen in a vertical root fracture. So vertical root fracture, they are associated with sharp, irregular, radiolucent line that extend along the root length. So vertical root fractures are the fractures that occur vertically around the tooth surface. So typically you would see a J-shaped radiolucency. So this J-shaped radiolucency, it is a feature of vertical root fracture. Along with that, you can see hollow-like appearance that is caused due to the inflammation. So there is bone loss that is seen with the vertical root fracture. Moving to next question, the best method to sterilize sharp edges instrument, it is by dry heat sterilization. So the dry heat sterilization is used. Why? Because other options like autoclaving, chemical claving, they involve moisture and steam. So that can lead to corrosion or dulling of the instrument edges. So that is why here we use dry heat sterilization. So dry heat sterilization, it is excellent at penetrating materials including the hard to reach areas of sharp edge instrumentation. So the most effective method for sterilizing the sharp edge instrument is the dry heat sterilization. So that uses high temperature to kill the microorganism and destroy their protein. That would ensure complete sterilization. Moving to the next question, the middle mesial canal, it is the mid mesial canal, you can see here. So it is most commonly seen with the permanent mandibular first molars. So this canal is the middle mesial canal. This one is the mesiobuccal canal. This one is the mesiolingual canal. This one is the diftobuccal canal. And this one is the diftolingual canal. So middle mesial canal, it is most commonly seen with permanent mandibular first molars. Irrigation technique that are based on negative pressure technology is the Endovac. Rotary brushes, they are not associated with the negative pressure technology in the irrigation. Rotary brushes, they are used for cleaning and shaping the root canal, and it does not create any negative pressure. Endoactivator, it is ultrasonic irrigation system that use sonic energy to activate the irrigating solution within the root canal system. Endovac, well, Endovac, it is based upon the negative pressure that will evacuate the debris and fluid from the root canal. The Navi tips, they are the specialized irrigation tip. They are used to deliver irrigation solution precisely to the target areas within the root canal. They also do not cause any negative pressure, so answer is C, that is endovac. Mechanism of action of sodium hypochlorite is all except. The answer is D, chelation. Well, option A, saponification. It can react with the fatty acid that can lead to breakdown of lipids, a process that is known as saponification, that disrupt the bacterial cell membrane and that lead to lysis. Amino acid neutralization. Sodium hypo can neutralize amino acid which are the essential components of the protein. So that can disrupt the protein structure within the bacteria cells, including the enzymes and structural protein. Chloramination, it is process by which sodium hypo forms chloramines in the presence of ammonia. So it can act as disinfectant and control and contribute to the microbial activity of the sodium hypo. Chelation, well, it is not a primary mechanism of sodium hypo. Chelation that involves binding of metal ions, which is not a primary function of sodium hypo in root canal irrigation. So answer is T. The main difference between pro-taping shaping files and finishing file . The shaping file, they have taper that increases coronally, whereas finishing file, they have taper that decreases coronally. So the shaping files, they are used to prepare and shape the root canal. So they have a taper that become larger as you move coronally toward the shaft. On other hand, finishing files, they are designed to provide a smoother finish and minimize the ledges or irregularities. So they have a taper that decreases coronally, allowing for better control and refinement of the canal shape. The progression of internal resorption, it will depend upon the vitality of the pulp tissue. The presence of vital pulp tissue that is important for initiation and progression of internal resorption. So internal resorption, it is characterized when the resorption of dentine occur from the inside of the tooth root. So the resorption, it includes the activation of cells that are the odontoclast that resorb dentine. So presence of necrotic tissue and pulp and vital pulp tissue, it is important for the internal root resorption and progression, which is the definitive way to determine the presence of vertical root fracture. So the definitive method is the surgical exposure or the flap surgery, flap reflection, that is the gold standard. So where the bones, they are surgically opened to visualize and assess the tooth root and surrounding structures. So that would allow for direct visual inspection of the root surface, and if any root fracture is present, it can be seen during this procedure. So surgical exposure, it is the gold standard and most reliable and definitive way to detect vertical root fractures. Other methods like crack probing, multiple sinus tract, halo-like bone loss, they may suspect a vertical root fracture, but they are not the definitive or conclusive as the surgical exposure.